Thank you. I want to say thank you to the team that worked on this project with me, including my mentor, Dr. Pritchno, and fellow faculty member, Dr. DeSouza, and students, Talon and Liani, who worked with me on this project. So we heard a little bit already about home healthcare workers and the challenges that they face, especially during the pandemic. They tend to have sociodemographic risk factors that put them at high risk for severe COVID-19 outcomes, including due to their age, poverty level, education level. There tend to be a high immigrant population in this group. And early pandemic studies indicated that they really felt forgotten on the first line. And as was mentioned through some of the questions, they tend not to be part of healthcare systems. So a lot of them are on their own and had to get the vaccine through just the regular community means rather than getting it through healthcare systems, where a lot of people who worked in hospitals or in nursing homes or other types of institutionalized care were able to get that assistance through their employers. So really the idea behind this was to understand what were the policies and procedures and systems that were in place in order to help support home healthcare workers, specifically home healthcare aides, who tend to have lower education levels and higher risk factors. And this is important because OSHA stresses that if you want people to come to work during a pandemic or in any type of emergency situation, they have to feel supported and safe. So how are the institutions, the home healthcare agencies helping home healthcare aides to feel supported and safe during the epidemic? So this was a mixed method study. The first thing that we did were qualitative interviews with home healthcare aides themselves in order to understand informational support that they may have gotten, instrumental support that they may have gotten or not gotten, and how that acted as barriers and facilitators to vaccination and to their feelings of safety during COVID-19. And what we did was we identified key informants, and we identified key informants throughout New Jersey. So South Jersey, Central Jersey, North Jersey, and we tried to identify key informants that represented both home healthcare agencies and personal choice, which is an option under Medicaid, where individuals can choose to pay friends, family members, in order to provide that care for them. So we were interested in not just agency employees, but also employees that were working as home healthcare aides through these personal choice mechanisms. And we used those key informant interviews to identify themes and ideas, which we developed into a survey, which we sent out to all of the home healthcare agencies in New Jersey, to the administrators, to ask the administrators what type of information and instrumental support they offered to their home healthcare aides during the pandemic around vaccination and COVID-19 protection strategies. So we got 37 surveys back that were completed from the home healthcare administrators. There was actually about 75 surveys, but we only counted the ones that were mostly completed, at least 75% completed. So that brought that number down to 75. And as you can see, for the administrators, the majority of administrators had at least a bachelor's degree or higher. Most of them had been working as an administrator in home healthcare agencies for longer than the pandemic period, for 4 years or more. They tended to be over the age of 50, and mostly female. So in terms of the qualitative results that we got from the home healthcare aides themselves, it really was that felt that the communication from agencies was almost non-existent, which is interesting because on the survey side, the administrators talked about all the different ways that they actually pushed out information. So there was definitely a disconnect between how the home healthcare aides perceived the information that they were getting and what the administrators thought that they were sending out. And their major influence that the home healthcare aides felt in terms of getting vaccinated themselves was due to knowing somebody who died or became seriously ill due to COVID-19. Getting recommendations from their primary care physician was very important for this group. And they all expressed a belief that the vaccination mandate policy was actually detrimental on both sides, the administrators and the home healthcare aides felt like people were getting sick anyway. So, forcing people to get vaccines really cut down on the number of home healthcare aides who are willing to do this work. And there's already a shortage of people willing to do this very difficult, low-paying work. And on both sides, the administrators and the home healthcare aides felt that the vaccine policy was detrimental to keeping a workforce available for home healthcare. In terms of knowledge, beliefs, and behavior from the administrators themselves, the rates of vaccination for at least the primary dose was about the same as it was for all of New Jersey. That also includes getting the primary vaccination series. You do see that when it comes to the booster, the home healthcare administrators have a much higher rate of full vaccination. And part of that is because it's actually required under New Jersey and federal law now that the home healthcare workers have the primary vaccine and the booster. So, but the administrators actually were generally early adopters. They got their vaccine, when it first came out and was available for healthcare workers, kind of the December through March timeframe. The majority of them did. And most of them said that they thought the vaccination was important to protect themselves against COVID-19. Those numbers went down when they were talking about responsibility toward protecting other people. But surprisingly, even though they said that they felt that it was important, 73% said the vaccine was safe, which means there was a non-significant percentage that felt like it was not necessarily safe, but might be important. And there was a lack of congruence between understanding of high risk and actually being at high risk. So there were a number of people who were at high risk due to factors such as smoking and obesity, but they did not self-identify as being particularly high risk. The really interesting thing is that, and I'll skip because I'm running out of time, but the really interesting thing is that the policies were not there to really support in terms of instrumental support for the home healthcare aides. So while they said that they sent out a lot of information, they didn't really give paid time off to staff to get vaccinated. Only 83% even gave paid time off if they had COVID-19. They definitely didn't give paid time off for quarantine or for caring for a family member. And they didn't tend to have policies like providing vaccinations on site or policies that would help support vaccination or keeping their staff and workers healthy during COVID-19. So take-home message is that both the home healthcare aides and the administrators believe that the vaccine mandate is detrimental to the keeping an active home healthcare workforce, that generally the feelings about vaccines weren't particularly positive. Only 62% of the admins actually reported getting a flu vaccine. So without the mandate, those numbers for vaccination probably would have been a lot lower. And there wasn't a lot of coordination between state and federal agencies and the home healthcare agencies and the workers themselves. So there's a lot of room for improvement in terms of making sure that home healthcare aides feel safe and supported.